Harbor Care really saved my life.
And what drew me to Harbor Care was the organization's mission, its people, and the real impact that the work that we do here has on countless lives across the state of New Hampshire.
The staff is phenomenal. I just can't say enough about it. It's just an amazing place.
Our mission encompasses many services that take care of individuals who are homeless or at risk of homelessness, military veterans, individuals struggling with addiction, and individuals that are struggling with their mental health.
I was in the NAMI group that was just kind of getting together here in Nashua. We all had children that were either improperly housed or in the state hospital. My son happened to be in the state hospital. And there was no appropriate housing for them. We kind of got on some soapboxes and let the world know that we need to do something about that.
In the early 80s, the housing and support resources for persons with serious mental illness was very limited. Our organization's main mission at that time was to work primarily with people with serious mental illness. The housing available for them was almost non-existent. We established a stable, safe, affordable place for folks to call home, and that is something that has been the core of our mantra to this day. What we were able to show is that people who had serious mental illness could live, adapt, and sustain for very long periods of time in the community. And that was something that wasn't very clear to anybody before all of the work that we did.
My name is Pamela Rainey, and I live at Group Home at Chestnut Street. I've been there for 4 years. I lived at All Street. I lived here at Winter Street back in the 90s.
We realized that housing is healthcare, and that just as you write a prescription as a treatment provider for a particular remedy, housing is often the remedy that can be most impactful in somebody's life. In addition to accessing affordable, safe rental housing that people could call home, many of the people that we were working with had a variety of medical conditions that required some in-home care services from traditional home health agencies. One of the things that I think also sort of has separated us, when it wasn't available, we decided to figure out, well, how could we do it and create it ourselves if it's not available in the community? So we spent a couple of years trying to research and develop a home health care organization of our own, which eventually became Healthy at Home. Harbor Care focused on veteran homelessness for many years. It started out with more of a general focus on homelessness, and as we noted more and more veterans who were part of that population, we began to communicate with the VA about it. It always dishonors all of us when a veteran is homeless somewhere on our streets. So we wanted to develop a facility where male veterans could be together, and also to have a facility where female homeless veterans and veterans with families could have a location in the same building. We were embarking on trying to find different facilities, and that led to partnerships with the city of Nashua and also with the VA. And it was the three of us working together that really resulted in acquiring, developing, renovating, and building 2 major facilities here in Nashua. We especially wanted to build into the program an environment where veterans could really support each other.
And I have gotten quite comfortable with the other veterans in this building, and it makes me feel like I do have some family and a place to belong.
That's the magic spark that really leads to those successes where veterans have this camaraderie and mutual support that only they can understand.
And Tom got me in here in a matter of 3 weeks, and I was so grateful. I had a roof over my head, I had a refrigerator to put my medicine in, and I had a place to let my dog sleep. And it's been outstanding here. The staff is wonderful. But I didn't want to get too comfortable because this is temporary transitional housing, and I'm safe and I'm happy, and this is a wonderful place.
As we were working with the veterans on their journey to establish stable housing, we knew very quickly that there were not enough employment options for veterans, and that led us to the operation of the Homeless Veteran Reintegration Program, which is funded by the United States Department of Labor. And that's a program that we've been operating now for 12 years with very great success. All of these resources combined, along with efforts in Manchester and Plymouth with Boulder Point, have culminated in an end to veteran homelessness as declared by the federal government Interagency Council on Homelessness. And it has been 5 years now that the effective end to veteran homelessness in Nashua has been declared, and we firmly believe that it's been sustained by the numbers that we've seen since that time as well.
I first got introduced to Harbor Care because I was a client. I was a client at Keystone Hall. There was a time when my life became unmanageable. I needed help with addiction. They were the only place that we could find that, you know, would take someone like me that didn't have insurance.
The Cynthia Day program is one of 2 treatment programs in the state of New Hampshire that offers the opportunity for women who have been abusing substances to have a pathway towards recovery, and also, more importantly, to have a pathway towards reunifying the family. It was named after Cynthia Day, who was an amazing volunteer who would run groups in a facility, and she was a real person who has shown success in recovery over many decades, and was inspirational to everybody in the program. She's been an ongoing support for us in our work, you know, from the beginning till now.
Harbor Care is unique because we have a very, very talented workforce, very committed. We also have a very diverse service offering that really spans many of the social determinants of health. And the challenges therein, and our services really address many of those issues.
Having access to medical services for the first time in our organization was a godsend. It was a blessing for the agency and a key turning point in our evolution towards our efforts for integrated care. Adding medical, oral health services, behavioral health and substance use disorder treatment services that were funded under the roof of a homeless federally qualified health center was an incredible blessing in our evolution as an organization.
Integration is a word that is used on a daily basis. It's a part of almost every discussion that we have here, and we're truly engaging so many different levels of care in any individual person, any client or patient's needs. We get all sorts of requests that come in, whether folks are walking in, whether they're an existing client of the clinic or a part of somewhere else across Harbor Care, through our HOPE emails, and so many other sources of requests are coming in. So as folks are engaging, we utilize a number of different mechanisms that get folks connected to whatever service it is they need. We've integrated screening questions, so our dentists are asking clients about whether or not they have a medical home, whether or not they have transportation, housing, food insecurity issues. So we use a number of mechanisms in order to screen folks to determine what needs they might have, and then making referrals to those programs across the Harbor Care umbrella. I really have embraced and have seen how this organization embraces the Housing First model. And frankly, it drives the success of our clients. Having stable shelter is so critical to so many of the other clinical outcomes that we're working with folks on. It's just an integral part of what we have to do, irrespective of whether it's medical, dental, mental health services. The housing team, both on the veteran and supportive housing folks within Harbor Care, they're a major part of what we do here. You see them on site. Their case managers are in and out of the door at our primary care clinics.
Dental services is an incredibly important part of the work that Harbor Care does. It's probably the part that we do that's most in need and just limited as a resource across New Hampshire. And we are very aware of how critical it is as a component of integrated care and key to one's overall behavioral health and overall physical health and just general well-being.
The accessibility that we provide to our patients, like offering sliding fee scale, that is completely unheard of. Throughout the organization, we follow our mission truly, and we always want to help our patients.
But what I really love here is we are able to help underserved population. So people who don't have money, don't have insurance, life-saving drugs like insulins, EpiPens, even inhalers, we are able to give them for less than $10 a month. The best part is we are able to fill their prescriptions, give them the medicine on hand before they leave the pharmacy. So medicine becomes affordable and accessible. That's kind of our goal in this pharmacy. Excellent customer care. So when the clients come, they get treated, at a very, as a red carpet welcome.
In our HIV program, case management is really the crux of what we do. Each client has their own case manager who's their link to the community to help make sure they get their needs met. We focus on healthcare, making sure that our clients can reach viral suppression, which means that their HIV is no longer active in their system, creating damage to their immune system. This is our food pantry where our clients can come in as often as they need and meet with their case manager to supplement their budgets and their needs for their family. So we have food that we get from the USDA, and then we also have some other grants that are provided to us that we can purchase food from the local market and from the New Hampshire Food Bank. And so we provide supports to folks so that that they can afford their medication, they can afford their doctor's appointments, that they have a safe place to live in order to store and take their medications, enough food to eat. We provide transportation services to our clients to make sure they can get to their appointments. We have a peer support program to help our clients deal with the challenges of living with HIV by talking with others that can understand their journey and have been in their shoes. We also have housing opportunities for people with AIDS.
Individuals approach us with multiple needs at the same time. It's rare that somebody comes and says, I just need help with just this one narrow thing. Integrated care for Harbor Care has been a very prominent effort and theme of all of our work. We view it in a slightly different way. First, I think what separates us in this is that we integrate healthcare, social services, behavioral health services, along with housing, whereas other entities typically don't do that. As far as I know, we're unique.
The future of Harbor Care is extremely bright. We have a very talented workforce. We also have services that are very closely integrated, so we can meet the needs, the many needs that are presented to our clients. And leaning on our long history of innovation, I'm very much looking forward to new program development and expanding new ways of addressing tough problems.
There's so many staff members who've been here for so long and continue to be here and continue to enjoy being here and working with each client to the best of their abilities. And I think that's the secret. It's the passion that the staff brings to work every day.
Seeing the clients that have no one and being able to be that support system for them to be able to have a quality of life that they would not have if it wasn't for this agency.
Every person that comes in, when they leave, they always leave better than when they got here. Because the staff are committed to the people.
For me, the best thing that illustrates Harbor Care is just watching someone get better.
The mission of Harbor Care is very relevant now, and it will be in the future. There is a significant amount of need across the state of New Hampshire within the many populations that we serve. And we have done a fantastic job of meeting those needs, but there's a significant amount of work that still needs to be completed.